My name is Eimear Duignan and I am a senior dietitian working in the neurosurgical service at Beaumont Hospital. You may have heard about different diets in the news or on social media that claim to help people with brain tumours. One of the diets that is often mentioned is the ketogenic diet. In this video I'll explain what this diet is and whether it is something we usually recommend to our patients. So the ketogenic diet is a diet which is very low in carbohydrate and very high in fat with a moderate amount of protein. When followed properly, this diet shifts the body's main energy source from glucose, which we get from carbohydrates, to ketones, which we get from fat. So why might someone with a brain tumour be interested in following a ketogenic diet? Well, it's known that cancer cells fuel their growth using glucose. Thus, the idea behind following the ketogenic diet is that by depriving the body of glucose through limiting carbohydrates and switching to fat as our main source of energy, the growth of cancer cells will be slowed down. But what does the evidence actually tell us? So currently there's no strong scientific evidence that the ketogenic diet helps people with brain tumours. Most studies completed to date have been on cells in test tubes or in animals. The few human studies that exist are limited and not of good quality, and for this reason we do not recommend the use of the ketogenic diet at this time. That being said, there is ongoing research taking place to evaluate whether or not there is a role for the use of the ketogenic diet as part of treatment of brain tumours. The diet has shown to be beneficial in treating other neurological conditions like epilepsy. The ketogenic diet by its nature is very restrictive, and people on this diet often experience unintentional weight loss, which is not recommended during treatment. The ketogenic diet can also cause side effects like constipation, nausea, headaches and tiredness, and may result in vitamin and mineral deficiencies. What we as dietitians do recommend is to aim to keep your body strong so that you are fit for treatment. This involves avoiding restrictive diets and aiming for a balanced diet which focuses on including a variety of fruit and vegetables, lean proteins like lean red meats, chicken, fish, eggs, nuts and pulses, whole grain carbohydrates like oats, brown bread, brown rice and pasta, and healthy fats. Keeping active, limiting alcohol and avoiding smoking are also recommended. You can find helpful tips and resources about how to implement a healthy eating approach on the HSE and Irish Cancer Society websites. There is also a useful booklet called Diet in Cancer, which is regularly updated and has been developed by the Irish Cancer Society and the Irish Nutrition and Dietetic Institute. So, in summary, at this time, given the evidence that we currently do have, we do not recommend our patients to follow a ketogenic diet during their treatment for brain tumours. If you are still interested in learning more or are thinking about trying an alternative diet as part of your treatment, please ask your doctor to refer you to a dietitian. They can help you understand if it's safe or suitable for your situation. The Truth Behind Food and Cancer is also a great resource that explains the current expert advice and what scientific research says about using diet and supplements as part of cancer care. After receiving a brain tumour diagnosis, people often wonder whether they need to follow a special diet. The answer to this question is no. What we as dietitians recommend is that you continue to eat a healthy, balanced diet. This is very important as it can help keep your body strong and fit for treatment. It can maintain your energy levels, maintain your immune system, which lowers your risk of infection, and support your recovery from treatment. Many people experience changes in appetite during treatment for their brain tumour. Steroids are a common medication used in brain tumour treatment, and one of the side effects of using this medication is that it can increase your appetite and may lead to weight gain. We typically aim to avoid big changes in weight during treatment, so if you're noticing an increase in appetite, it's a good idea to adopt a healthy eating approach to avoid gaining too much weight. It's helpful to include a variety of vegetables, salad foods and whole fruit throughout the day, aiming for around half of your plate at each meal to be composed of these foods. It's also important to choose moderate amounts of high fibre carbohydrate foods, such as whole grain bread, cereals, jacket potatoes and brown pasta or rice. These will help keep you full for longer and support healthy digestion. It's important to include high protein foods, but better to choose low-fat options as these are lower in energy when weight gain is a concern. Examples of suitable low-protein foods include lean red meats and poultry like chicken and turkey, fish, eggs, beans and lentils, and low-fat dairy foods, for example light milk and yogurt. As fats are high in energy, it can also be best to avoid using oils, butters and spreads. Drink plenty of fluids, especially water or low-calorie drinks to stay hydrated. Low-fat milk is also a great option. If you feel hungry between your meals, have healthy snacks ready. These include snacks that are high in protein or high in fibre, like a boiled egg, high-protein yogurt or pudding, fruit, nuts or whole grain crackers. It's important to try and avoid high-fat, high-sugar options like crisps, chocolates or confectionery. Light or gentle exercise is also helpful. It can support a healthy weight, improve your mood and reduce fatigue. Aim to stay as active as your energy levels and treatment allow. Even a short walk can make a big difference. For more detailed healthy eating tips and snack ideas, you can visit the HSC and Irish Cancer Society websites, which give guidance on portion sizes, meal plans, and healthy lifestyle tips and recipes. The Irish Nutrition and Dietetic Institute also offer helpful food fact sheets for weight management and healthy snacks. Brain tumours and their treatment can make eating and drinking more difficult. You may experience lower energy levels to prepare meals. You may experience feeling full quickly at meal times. You may have a reduced appetite, and because of all this, you may have unplanned weight loss. If this happens, it's important to look at getting enough nourishment, even if that means putting aside the usual healthy eating advice for a while. Losing weight during treatment is not recommended, as your body needs extra energy, protein, vitamins and minerals to help keep your body strong so you can cope with treatment, help fight infection, and help your body recover upon completing treatment. Here are some simple things that may help. Eat your main meals when your appetite is best, even if that's at breakfast time. Have small meals and snacks every 2 to 3 hours, rather than 3 larger meals. Sometimes people find setting a timer useful to remember to take a snack or a meal. Add extra energy and protein to your foods to make even small portions as nourishing as possible. Foods such as avocado, nut butters, seeds, cheese, syrup, cream, butters and oils can be used to make foods more nourishing. For example, adding a thick layer of butter to a slice of bread, adding full-fat butter to mashed potatoes and veg, adding cream to your porridge or your soups, or sprinkling grated cheese on top of your scrambled egg or pasta. Avoid drinking large amounts of fluids with your meals, as this can fill you up during meal times. Aim to have your fluids separate to your meals and opt for full-fat milk or hot chocolate or any of those foods based on milk. Cook in batches when your energy levels are good, and freeze some portions for when your energy levels may be reduced. Try gentle activity like walking to help boost your appetite. If you are struggling to eat or are losing weight, please ask your medical team to refer you to a dietitian. A dietitian can help you find ways to maintain your weight and make changes to your diet to manage the side effects of treatment, such as taste changes, nausea, bowel issues, and swallowing difficulties. Your dietitian may also suggest oral nutritional supplements. These are drinks that are high in calories, protein, vitamins, and minerals. They come in a range of types and flavours, and the dietitian can order samples to be delivered to your home for you to try in your own time. Once you find one that you like, you can ask your healthcare team for a prescription, and this prescription can then be filled out through your chemist. These drinks are covered under the medical card scheme and the drugs payment scheme. If you have a poor appetite and need more information, please refer to the following resources, which are useful for patients undergoing cancer treatment. The last 2 booklets, the Good Nutrition for Cancer Recovery and Eating Well with Swallowing Difficulties in Cancer, are available to order in hard copy through the Breakthrough Cancer Research website.